Hi, this is Dr. Zanis, and I'm here today to talk to you about something really important. This is a free video on the 5 things you absolutely must ask your plastic surgeon before going under the knife. Now, these are 5 questions which, at the bare minimum, every patient should find the answers to before undergoing plastic surgery. And although a lot of my patients don't ask these questions at the time of a consultation, I always give them the answers to them because I know how important they are. Number 1, you must ask, are you certified in plastic surgery? Board certification can mean many things, but board certification by the American Board of Plastic Surgery is what's critical. It is the only board that is recognized by the American Board of Medical Specialties. What does that mean? That means that at the very least, the plastic surgeon you are seeing has undergone 5 to 7 years of vigorous training in surgery and has tested both written and oral tests that demonstrate that he or she is safe and proficient in the field of plastic surgery. So at the very minimum, board certification by the American Board of Plastic Surgery is critical. Number 2, do you specialize in this area, whatever area it is that you are interested in? Although a plastic surgeon has trained in many different areas from head to toe, the entire body is part of plastic surgery. It doesn't mean that after residency, he or she continues to specialize and focus on that area. For instance, I do a lot of breast surgery, rhinoplasty, and tummy tucks. These are my strongest areas, and I consider myself a breast expert. Although many plastic surgeons do breast augmentation and lifts and reductions, it doesn't mean that they do them as intently and as frequently as I do. On the other hand, I haven't done a cleft lip repair since I was a resident, and by no means would I consider myself an expert in cleft lip or cleft palate repair. So I would not recommend coming to me for that specific surgery. So ask your surgeon, how many of these do you do per month? Is it something that you really particularly focus on? And if so, demand to see before and after pictures. Request that you look at a portfolio of before and after pictures for the specific procedure that you're interested in that surgeon performed. And there should be hundreds of those pictures. If there aren't many pictures for you to look at, either the surgeon doesn't do a lot of that procedure, or they just aren't meticulous enough to take good photographs and keep them in an organized before and after gallery, which they should. The third thing that you really must ask is about expectations. What can I truly expect to get out of this surgery, given my body, my conditions, and your experience? The biggest cause for dissatisfaction in cosmetic plastic surgery is usually a lack of communication and inappropriate, unrealistic expectations about the outcome. So your surgeon should be able to express to you in very real terms, and including illustrations or pictures, what you in particular can expect to obtain through this operation. And some people are better candidates for some surgeries than others. It shouldn't be embellished or given false expectations. I want my patients to know exactly what they're expected to get, because then if they choose to go through with the surgery, they'll be happy because they got into it knowing what they were going to get out of it. Number 4, something a lot of people do ask about, is risks, complications, and possible solutions. Every surgery has the opportunity for a bad outcome. What you really want to know are, what are the most common complications that you see? Not what's the whole long list of potential things, that's important, but what really matters is what are the top 2 or 3 complications that you regularly see through this procedure. So from a tummy tuck, you might say seroma, or numbness, or a hematoma, things like that. And your surgeon will discuss what those terms mean and how often they happen. And then more importantly, if they do happen, what are the implications, and what do you as a surgeon do to resolve the problem? And then finally, what type of anesthesia will be used for my procedure, and in what setting will the surgery be done? I'm here in one of our 2 operating rooms, and we have an accredited surgical suite. This is accredited by the Quad ASF, which is the American Association for the Accreditation of Ambulatory Surgical Facilities. And that's important because if you are doing a procedure in an unaccredited facility, that means that the facility has not been examined and required to maintain a certain set of high standards for patient safety. So you want an accredited surgeon, a board certified surgeon, but also one who operates in an accredited facility. And the type of anesthesia, local, IV sedation, or MAC, general anesthesia with a ventilator, all those are options. You want to know what your surgeon plans to use for you and why, and what that entails. So if you get these 5 questions out of the way during a consultation, you can bet that you'll be more informed than the majority of cosmetic surgery patients before choosing to undergo an operation. I hope this has been helpful for you, and please, if you have any questions further, feel free to contact me.